A Treasure Valley child is home recovering tonight after becoming the area's first confirmed case of multisystem inflammatory syndrome in children. Thanks for joining us tonight. I'm Karen Lair.
And I'm Don Nelson. The illness is a serious complication in children confirmed to have COVID-19 requiring hospitalization. As Karen reports tonight, the child is recovering after 4 days in the pediatric ICU.
Nearly 4 weeks after COVID-19 exposure, a 7-year-old Treasure Valley girl became the area's first diagnosed case of MIS-C, or Multisystem Inflammatory Syndrome, in children.
These are really profoundly sick patients.
The patient was transferred to St. Luke's in downtown Boise last Wednesday. After 4 days in the ICU, she returned to the main hospital floor Sunday and was discharged to continue recovering from home on Monday.
This is actually a really great success story.
Although this was St. Luke's 11th child hospitalized with COVID-19, it was the first with MIS-C. That means the patient experienced a combination of severe symptoms impacting multiple systems, such as respiratory, cardiac, and gastrointestinal.
Patients frequently need IV fluids. They commonly need blood thinning medications because of the risk of clotting. They commonly need pressors like norepinephrine and epinephrine to maintain their blood pressure. And they also commonly need additional infusions to treat this overvigorous inflammatory response.
So far, at least 570 children in the U.S. have been diagnosed with MIS-C, with 10 cases turning fatal. Symptoms vary drastically from patient to patient, but could include things like persistent fatigue, bloodshot eyes, swollen tongue, cracked lips, abdominal pain, and severe flu-like symptoms.
One of the systems that can be involved is the respiratory system, where you can have a persistent cough or shortness of breath.
Although more research is needed, Dr. Bramwell says so far, MIS-C has not proven to be more contagious among children than COVID-19 itself. The illness instead is a result of a patient's personalized immunoresponse to the virus. Karen Lair, Idaho News 6.
Dr. Bramwell says right now there are no known long-term effects of MIS-C, and although this was their first case, St. Luke's does expect to treat more patients over the next few months.